We are pleased that you are interested in the Beach Chair Splint by Samarit and wish you every success in using it in the operating theater. This is what you will see. The more you work with it, the easier you will find it to handle. The Beach Chair Splint was developed by the posture specialist Willie Albrecht jointly with Samarit in the operating theater and is patented. Before you start, please watch this short instruction DVD. The Beach Chair Splint can be used on most operating tables. It fills an important gap between the operating table and the headrest. The Beach Chair Splint is perfect for shoulder surgery, open or arthroscopic, for goiters, jaw surgery, facial surgery, and for operations on the carotid artery. It may also have applications for neurosurgery. What are the advantages of the Beach Chair Splint by Samarit? It makes positioning the patient easier and better. It supports the spinal column, especially in the chest, throat, and head areas. It increases safety, particularly if the headrest accidentally becomes tilted. Head and neck cushions can each be adjusted to the patient's anatomy. It prevents the back coming into contact with the metal of the operating table. The inflatable cushion makes it easier to intubate the patient, and it enables correct positioning for scaling blocks. The patient's comfort is maximized thanks to temper cushions. It helps to prevent postoperative problems in the throat and neck area connected with the position the patient was in during surgery. It offers excellent lateral stabilization thanks to the thorax plates and the fixation strap. Velcro strips have been attached to these points so that the head can be easily, efficiently, and quickly removed. In order to comply with hygiene regulations, Samarit has developed disposable cushions to hold the forehead and chin in place and support the thorax. They are latex-free and skin-friendly. If other items are used, we accept no liability. Place the Beach Chair Splint on the upper end of the operating table and adjust the headrest so that the splint is lying flat. By applying pressure to the back, you can tell whether there is still a gap between the Beach Chair Splint and the table. You can now remove the wings if need be, or just let them hang down. You should now cover the splint with a transparent protective bag. Place both thorax straps with the plates through the lateral openings. For the time being, let them hang down over the side of the table. To ensure that the patient is comfortable, the Beach Chair Splint is equipped with back, neck, and head cushions in temper that are also suitable for longer operations. If the padding is hard, a gel mat can also be used. This can be raised up to splint level. You can roll up the lower part of the gel mat to protect the patient's heels. Cover the thorax plates with the disposable cushions. Now bring the forehead and chin straps to the splint. And place your usual cover over the table. Gently fold out the leg plates. Lower the table to the maximum Trendelenburg position. Lift up the upper body plate until it is horizontal or slightly raised. When the patient is lying on the beach chair splint, loosen the length adjustment screws of the operating table. Now pull the splint under the patient towards the head until the throat and head are lying comfortably on the splint. Then tighten the screws back up. If necessary, using the hand pump, the one with the black tube, inflate the head cushion. To support the cervical spine, pump up the neck cushion with the bellows with the red tube. The handling for both types of insertion is the same. Attach the arm on the side that is to be operated on with the thorax straps. If you want the head to be reclined, for example to make intubation easier, so that it is tilting backwards, release some air from the head cushion and pump more air into the neck cushion. Incidentally, the position where the head is turned to the side is suitable for the use of scalene blocks. Now deflate the neck cushion. Lower the leg plates on the operating table. Start lifting up the patient from the head-low position, that is, gradually raising the patient from the Trendelenburg position. This will stop the patient from slipping too much. Pump up the head cushion. Then adjust the neck cushion, pumping it up too as required. Loosen the thorax strap. This will release the arms. Then reattach the thorax strap under the patient's chest. Tighten it until the anesthetist in charge considers it to be right. While doing this, keep an eye on the ventilation pressure. Fit together the chin strap and the chin cushion. The pad is brought to the tip of the chin. Now attach the forehead with the forehead cushion. Lift up the patient as far as possible out of the Trendelenburg position. Check that the patient's shoulders can move around freely. Check once more that you are working on the right side. Loosen the chin strap. Lower the operating table to the maximum Trendelenburg position, making sure you only bring the seat plate to the head-low position. Bring the upper body of the patient down gently. Now, at the same time, start to lower the upper body and raise the patient to the Trendelenburg position. Loosen the thorax strap and attach the patient's arm to protect it. Now the patient can be taken safely to the bed transfer room. The positioning cushion is used to intubate the patient in the Jackson position or for patients with degenerative spinal changes. Thanks to the support block, the beach chair splint can be used on a normal flat operating table. In this way, the patient can be placed on the edge of the table in order to keep the shoulder free. Users of the beach chair splint have had positive experiences. The beach chair splint physically supports the people to be positioned. It helps the staff to coordinate more effectively the moves involved in positioning the patient. It makes it easier for the anesthetist to intubate the patient. It helps the surgeons by ensuring the thorax is more stable. It improves patient safety by stabilizing the spine and ensuring the patient is lying more comfortably. It prevents long-term physiotherapy caused by problems in the throat and neck area. It helps to prevent liability cases following damage caused by the patient's position during surgery.